Hi everyone, I'm Marisela Perez and I'm presenting you today PPH Medication Management. Hi, so first off, in a PPH, one of the main medication management is you're going to use IV fluids, and your main fluids are going to be normal saline and lactated ringers. You're going to give this 1 liter infused as rapid as possible, so bolus, within 15 to 20 minutes. The main purpose of IV fluids is to prevent a hypotensive reaction to the loss of blood. So your next step in medication treatment is going to be oxytocin, Pitocin, and this is going to be given 10 to 40 units and 500 to 1,000 milliliters of prescribed IV solution, or 10 units IM. So you have two choices. You can give IV or IM. Frequency, if you give IV, it's going to be continuous. The onset is immediate and duration is 1 hour. So the main purpose of oxytocin is to produce uterine contractions, which will then control bleeding. Please make sure you don't administer an undiluted rapid IV infusion, because this will cause hypotension. Another form of medication management is misoprostol, which is Cytotec. You would give this 600 to 1,000 micrograms PO, sublingual, vaginal, or rectal. Frequency is you're only going to give 1 dose. The onset is 3 to 4 minutes. Do not administer to history of allergy to prostaglandins. This can cause fever and tachycardia. And the main purpose for this medication as well is to produce uterine contractions. Another form of medication management is Methergin. Methergin is given IM. The dose is 0.2 milligrams. You can give it every 2 to 4 hours. Onset is 7 to 15 minutes. It lasts about 3 hours. This medication also is to produce uterine contractions. It's very important that you don't administer this medication to a hypertensive or preeclamptic patient, because it would just increase the hypertensive reaction. Okay, lastly we have Hemabate. Hemabate, the dose you would give is 0.25 milligrams IM. Frequency would be 15 to 90 minutes. Every 15 to 90 minutes, 8 doses maximum. So onset and duration is mostly unknown, but it peaks within 15 to 30 minutes. This medication you would use cautiously in renal, hepatic, or cardiac disease patients. Contraindicated, very important, you don't administer to asthma patients. One reason, it can cause wheezing. It can increase the wheezing, so you would have an asthma reaction episode. Another 3 side effects that are very common is diarrhea, vomiting, and nausea. Fever, headache, bronchial constriction, tachycardia, and uterine rupture may occur. The purpose of this medication as well is to produce uterine contractions as well. Okay, so I focused on the medications that are found on the PPH medication kit management. There are more medications that can be given. One of them is TXA. It's commonly used. I believe when you have, like for example, when you get an admission, you will, on report, they will tell you they administered TXA if the patient was PPH. However, that medication is not found in the medication PPH kit, so I focus more on the medications that are found in the PPH medication kit. Okay? Thank you.